We've long known about racial and ethnic bias in healthcare, but now we're getting some firsthand knowledge of how pervasive it is from people within that system through the largest study of its kind. The report was based on interviews with doctors, nurses, dentists, and mental health workers. William Brangham breaks down the study's findings, part of our ongoing coverage of Race Matters.
In this study from the Commonwealth Fund, nearly half of healthcare workers in the U.S. say racism against patients is a major problem, and equal numbers report that they have personally witnessed discrimination against patients in their workplace. Employees at facilities that mostly serve Black or Latino patients reported higher instances of discrimination. To expand on the study's findings and why it matters, I'm joined by one of its co-authors. Dr. Lori Zeffrin is Senior Vice President for Advancing Health Equity at the Commonwealth Fund. Dr. Zeffrin, so good to have you on the NewsHour. So half of healthcare workers say racism is a major problem. They've seen it in their own workplaces. I'm curious why you chose to look at this issue from this perspective.
Yeah, thank you, and thanks for having me. Previous research really tells us that racism and discrimination impact healthcare outcomes, especially for people of color. This study goes a step further, really spotlighting the voice of healthcare workers who witness racism and discrimination and also experience it themselves. In terms of why healthcare workers, understanding what healthcare workers are experiencing, and what they need from their employers and colleagues to address discrimination is really critical to successful and sustainable change. Healthcare workers are a key part of the healthcare system, and they can be a part of the solution. We do know that the perspective of patients and providers are incredibly important, but for this study, we decided to focus on healthcare workers because they're on the ground. They impact the day-to-day care of people, and healthcare workers are living and breathing in the healthcare system every day. They really experience the realities of what it is to provide healthcare firsthand.
One of the more striking disparities in this was the perspective of Black healthcare workers. And I'm going to put this graphic up. While half of all healthcare workers said doctors are more accepting of white patients advocating for themselves compared to Black patients, it was 70% of Black workers who said this. I mean, that kind of perspective just has to really leap out at you.
Yeah, it does. It does leap out at you. Where you come from is important. Diverse experiences are incredibly important. The data are clear, just in general, on the importance of a culturally diverse workforce. It has a really profound impact on the healthcare system, on the patients served. I'm sure you've seen the data about diverse workforce. It can address cultural needs, language needs, improve communication, improve patient satisfaction. And there also may be more awareness of the impacts of discrimination and bias because of lived experience.
There was also similar disparities when it came to language differences, with over 70% of Latino workers saying that non-English speaking patients just don't get the same kind of care as English speaking patients. Do these disparities, do you believe, actually impact patient outcomes?
There are data that support the linkage between discrimination and impact on quality of care. So we do know that there are significant disparities and inequities in outcomes, whether we're talking about maternal mortality and the crisis we're experiencing in this country, or we're talking about inequities in life expectancy. We do know that where you live, work, play impacts your outcomes, right? And there's impacts of discrimination and racism on the social determinants of health. So we certainly have data that support this linkage. And to your point earlier, for people that have lived experience, whether it's race, ethnicity, language, other aspects of culture, there just may be more of a understanding, more of a recognition, more of a sensitivity to witnessing and discrimination within the healthcare system.
There was also an interesting generational divide, with older healthcare workers not seeing quite as striking a level of crisis as younger workers did. What do you attribute that to?
Yeah, we didn't ask why in the study, and so you don't know what you don't know. But a few things come to mind in terms of why younger people, younger healthcare workers are seeing more. This could reflect a generational shift in healthcare workers being more equity oriented, in younger workers who recognize equity as a key component of healthcare outcomes. So we need more research to clarify these generational differences, and more research could be potentially important to inform efforts to really prevent younger healthcare workers from leaving the profession.
On that issue, you talked with workers about what they would like to see done to make things better. What were the sort of general principles they articulated?
Creating a safe reporting environment was one that came up as crucial. So the study found that witnessing discrimination creates stress, and also that healthcare workers fear retaliation. So having a safe reporting environment that not only supports reporting, but also helps with reconciliation is really important as well. I think education also remains crucial to engendering reform, and training is going to be very critical, not just anti-bias training, but also training recognizing that discrimination can be a game changer in healthcare, that it can impact quality of healthcare outcomes, and also be able to recognize the signs of discrimination.
All right, Dr. Lori Zephyrin at the Commonwealth Fund, thank you so much for being here.
Thank you. Thanks so much for having me.